You gotta do this as a dental hygienist. And I wish I knew about this sooner in my career. Let's talk. I know sometimes we are so focused on scaling the teeth, removing the calc, plaque, stain, making sure our difficult prophy patients or perio maintenance patients leave with the cleanest teeth ever. But in order to make a huge difference in your patient's oral health, you gotta use a few minutes of the appointment to assess their home care. Seriously, don't skip this. You can clean their teeth perfectly, but if they're not brushing or flossing correctly at home, they'll just come back with the same issues. So take a few minutes to watch them brush and floss right there in your operatory. You can use the goodie bag dental products you give them to have them demo it right in front of you. You'll be shocked on how many people still use the seesaw motions for flossing or completely miss their gum line when brushing. So once you assess, you can correct their technique right there on the spot. You can hold a mirror for them and show them those few minutes of patient education can lead to way less calculus buildup next time. It's a long-term time saver. I know it's stressful to take away those few minutes from your already compacted appointment time, but a few minutes of education now can lead to cleaner teeth next time. When I was a new hygienist, of course I would talk about home care, but I never had them demo what they do at home in the chair. Once I started doing the demos, basically grading them on how they brush and floss, I was finally able to see changes in my patients' mouths. Of course, not all of them. There can be different reasons as to why they are building up so much, but with lots of them, it all came down to simple changes in brushing and flossing techniques at home. I was able to help correct any incorrect techniques right there on the spot that I was seeing. And then they would come back next time with such better hygiene, so much less buildup. And if they use electric toothbrushes or water flossers, I ask them to bring whatever they use to their next appointment so I can check how exactly they're using any fancier gadgets they use at home. Patients love that personalized care, and we, the clinicians, love healthier mouths. It's a win-win for everyone. The hardest part is taking time out of that initial appointment to assess them. But once you do, it's so worth it. And bonus, if you want to recommend the Better Mouth app, I've been doing this with all my patients as well. It's a free app that tracks their brushing and flossing streaks so they stay on track between dental visits. It's like giving them a hygiene coach every single day. And then next time they see you, they can report back and show you their updates in the app. We can only do so much for their mouths twice a year or 4 times a year, depending on their recare frequency. We can only do so much. It's what they do at home every single day in between dental appointments. That's everything, right? So assess, and then if needed, instruct them on how to improve what they do at home and be ready to be pleasantly surprised the next time you see them.